spread of COVID-19 while in public places, use common sense. Stay home and avoid parks if you're feeling sick. Practice social distancing. Avoid groups or gatherings larger than 10 and stay at least 6 feet from others while exercising. In addition to social distancing, Hillsborough County leaders continue to urge residents to wear cloth face coverings when in community settings. Bring your own water. Though parks are opening, many amenities will remain closed. Prepare for your visit by packing necessary items like hand sanitizer, and it's a good idea to bring your own disinfectant wipes to wipe down any public surfaces before touching or when touching public equipment. But remember, don't flush them after using. Residents who do not abide by the social distancing requirements or listen to instructions from county staff while enjoying the parks will be asked to leave the property. We encourage you to visit hcflgov.net/stay safe for up-to-date information.
A lot of things have been canceled, a lot of things have been postponed, but definitely not kindness. And we want to spread the kindness in our community and know that our first responders are still here for you. And thank you for staying at home for us, and we are here for you. So today we are here to surprise a little boy who is turning 9. He just moved to the county with his family and is very quiet, very shy, but has an affinity for fire trucks. And so what better way to welcome him to Hillsborough County and also maybe celebrate a little bit of his birthday by bringing one of our very own fire engines and a rescue to do a little drive-by, especially during this time.
We hear someone's having a birthday here. Is someone having a birthday here? Happy birthday, Kristen.
Hillsborough County leaders and local health experts want to get a clearer picture on how many residents may currently have the COVID-19 coronavirus. To help those efforts, testing criteria has been expanded. Now, any resident wishing to be tested for COVID-19 can call 813-272-5900 weekdays between 8 a.m. and 5 p.m. to request an appointment. You do not need to be experiencing COVID-19 symptoms to receive a test, but the Centers for Disease Control and Prevention has added 6 new symptoms to its existing list. COVID-19 symptoms include fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. If you develop any emergency warning signs for COVID-19, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to get up after sleeping, or bluish lips or face, you should seek medical attention immediately. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives. We encourage you to visit hcflgov.net/stay safe for up-to-date information.
If the COVID-19 coronavirus affects one of us, it affects all of us.
It does not discriminate based on race or ethnicity.
We are in this together, and when we work together, we are stronger as a community. Each person that has accurate and timely information about COVID-19 not only helps him or herself, but it's helping the entire county.
That's why Hillsborough County needs your input in the anonymous Stay Safe survey. Your feedback will help Hillsborough County provide you and your loved ones with necessary information and resources to get through this COVID-19 pandemic together.
It takes just a few minutes. I've taken the survey, and now I challenge you to be a community player. Text Stay Safe to 73224 or visit hcflgov.net/stay safe input to take the survey.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/stay-safe for up-to-date information and tips.
So due to our closures of all of our congregate dining centers and senior centers because of the COVID-19 pandemic, we have 26 different locations that we're still providing meal services for, although today is one of our 10 grab-and-go locations. The grab-and-go locations were established at the locations where seniors live in our senior high-rises, senior apartment complexes, and for that we work with our food vendor and we're able to literally bring frozen meals to our seniors, and then we're delivering 14 frozen meals to our seniors every other week, so we make sure that they continue to receive the nutritional meal that they would have if they were still attending one of our congregate dining centers.
The meals are wonderful. To me, they're restaurant quality. There's a wonderful variety. It's quite enjoyable. We're used to coming downstairs, having lunch every day, and most of us have given up our cars, so we don't have a car. We don't have the bus to take us to the store, but it would be worse if we had to put together meals ourselves with what we have. To know that the county is taking good care of us and bringing these frozen meals to us, this is very much appreciated. The county takes care of the seniors, and we are eternally grateful. We're very grateful.
With this pandemic that we are all experiencing, often seniors are a forgotten population. So for our department to continue to stay connected to our seniors, it is crucial for their mental, spiritual, and emotional health. And also we are providing a nutritional value. We're making sure that they are still receiving a nutritional meal. And the feedback that we continue to receive from our seniors is, thank you, thank you, thank you. You are saving me from self-isolation and just going into a state of depression.
Si el coronavirus, el COVID-19, nos afecta a uno, nos afecta a todos nosotros.
COVID-19 no discrimina por raza o etnicidad.
Estamos juntos en esto. Cuando trabajamos juntos, somos una comunidad más fuerte. Todos que tengan información del COVID-19 precisa y oportuna, no solo se ayuda a uno mismo, pero también ayuda a la comunidad.
Es por eso que el condado de Hillsborough necesita su opinión en la encuesta anónima Stay Safe. Sus comentarios ayudarán al condado de Hillsborough brindarle a usted y a sus seres queridos la información y los recursos más útiles para ayudarnos a superar la pandemia de COVID-19 juntos.
Solo toma unos minutos. He tomado la encuesta y ahora lo desafío a usted para que sea un colaborador de la comunidad.
Envíe Stay Safe Español a 73224 o visite hcflgolf.net/Stay Safe Input para realizar la encuesta.
Hillsborough County has opened a majority of its conservation parks, trails, and nature preserves to give residents additional options for recreation and exercise. While parks can provide an escape and excitement, county leaders are urging residents to take precautions to protect themselves. To help stop the spread of COVID-19 while in public places, use common sense. Stay home and avoid parks if you're feeling sick. Practice social distancing. Avoid groups or gatherings larger than 10 and stay at least 6 feet from others while exercising. In addition to social distancing, Hillsborough County leaders continue to urge residents to wear cloth face coverings when in community settings. Bring your own water. Though parks are opening, many amenities will remain closed. Prepare for your visit by packing necessary items like hand sanitizer, and it's a good idea to bring your own disinfectant wipes to wipe down any public surfaces before touching or when touching public equipment. But remember, don't flush them after using. Residents who do not abide by the social distancing requirements or listen to instructions from county staff while enjoying the parks will be asked to leave the property. We encourage you to visit hcflgov.net/stay safe for up-to-date information.
A lot of things have been canceled, a lot of things have been postponed, but definitely not kindness. And we want to spread the kindness in our community and know that our first responders are still here for you. And thank you for staying at home for us, and we are here for you. So today we are here to surprise a little boy who is turning 9. He just moved to the county with his family and is very quiet, very shy, but has an affinity for fire trucks. And so what better way to welcome him to Hillsborough County and also maybe celebrate a little bit of his birthday by bringing one of our very own fire engines and a rescue to do a little drive-by, especially during this time.
We hear someone's having a birthday here. Is someone having a birthday here? Happy birthday, Kristen.
Hillsborough County leaders and local health experts want to get a clearer picture on how many residents may currently have the COVID-19 coronavirus. To help those efforts, testing criteria has been expanded. Now, any resident wishing to be tested for COVID-19 can call 813-272-5900 weekdays between 8 a.m. and 5 p.m. to request an appointment. You do not need to be experiencing COVID-19 symptoms to receive a test, but the Centers for Disease Control and Prevention has added 6 new symptoms to its existing list. COVID-19 symptoms include fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. If you develop any emergency warning signs for COVID-19, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to get up after sleeping, or bluish lips or face, you should seek medical attention immediately. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives. We encourage you to visit hcflgov.net/stay safe for up-to-date information.
Good afternoon, everyone. I'd like to call the Emergency Policy Group meeting to order. Hope everyone had a pleasant weekend. Let's have the roll call, please. Is the clerk there?
Sorry, Miller.
Here.
Merman.
She's here.
Thank you. Oberman.
Here.
Lott.
Here.
Ross.
Here.
Kasich.
Here.
Chronistick.
Here.
Snively.
Here.
Mr. Merrill.
He's here.
Thank you. You have a quorum.
Okay, we're now moving to public comment. Our first speaker is Karen Lynch. Karen Lynch. Okay, Debbie Clark. Debbie Clark. Nathan Jurens.
Yes, I'm here.
Go ahead, sir.
Go.
Yes, go ahead.
Yes, my name is Nathan Christopher Jurlitz. I am a resident of Hillsborough County. My family owns Action Lock and Safe, which has been there since 1997. So I'm very concerned about the security and safety of people. I'm also a Bible college student under Rodney Howard Brown's The River, majoring in government. And I'm very concerned about the obviously safety of our people.
Oh, I keep calling the wrong number. I'm sorry.
Sir, hold on just a minute, sir. Hold on just a minute, sir. Can we mute Commissioner Merman right now?
Yes, sir, Chairman. I just muted her.
All right, sir. Go ahead, sir. I'm sorry. I didn't mean to interrupt you, but we'll give some feedback. Go ahead, sir.
Okay. Sir, my name is Nathan Jurlitz. I'm a concerned citizen of Hillsborough County, Florida. My family owns Action Lock and Safe, which has been serving the community since 1987 and that 4053 Gun Highway since 1997. I'm also a citizen journalist with MediaMogul.com, and I have over 2 million views on Facebook. I'm very concerned about the safety and security of the people of Hillsborough County, but not at the expense of violating our Constitution. I'm calling to join Vice Mayor Ross in his concern for using cell phone data to conduct COVID contact tracing in Hillsborough County. In the EPG meeting Thursday, May 7th, 2020, Vice Mayor Ross was correct when he said, it's not cell phones we are tracking, it is people. I agree with Mr. Ross that this is disturbing, and I'm relieved that the Supreme Court of the United States agrees with me. Use of this data to conduct individual contact tracing on the personal level is a serious violation of the civil rights of the people of Hillsborough County and any person who happens to be caught up in this unconstitutional dragnet. The taxpayers of Hillsborough County should not have to pay to defend an action of the EPG that the Supreme Court has already deemed unconstitutional. The EPG must refuse to use this technology for any form of COVID contact tracing. I'm also a Bible college student at the River under Rodney Howard Brown, majoring in government. And I just got to say, right now, there's a lot of government officials that are probably going to get in trouble. There's over 154,000 sealed cases in Pacer.gov. And it looks like our own president, past president, Obama, is going to get in trouble for spying on the Trump campaign when the FISA ends up getting declassified. So I think that if we could just take that and if we could all follow the trend of not spying on our citizens and not tracking our citizens, because just because it's safe doesn't mean it's constitutional. There were plagues around when the forefathers wrote the Constitution. So you
Thank
can't
you, sir. Sir, your 3 minutes are up.
Keep everyone home and track
Sir,
everyone.
your
Just
3 minutes are up, sir.
Thank you.
Aaron Sharp.
Hey there. My name's Aaron Sharp. I'm a small business owner in Hillsborough County, and I have the unique perspective of being able to service people from all over the county from many different viewpoints, many different ethnicities, and many different political backgrounds. And I have to say, having spoken with perhaps hundreds of people, not only in my place of business, but also in the lines of the grocery stores and the hardware stores and everywhere where we're supposed to be socially distancing and protecting ourselves, the overwhelming opinion is there's a massive government overreach happening right now. And I just want to go ahead and quote the Constitution of the United States, Amendment 4, the right of the people to be secure in their persons, houses, papers, and effects against unreasonable searches and seizures shall not be violated. The word shall not be violated, and no warrant shall issue but upon the probable cause supported by oath or affirmation, and particularly describing the place to be searched and the persons or things to be seized. The government has no right, has absolutely no right to contract trace folks in this county. It is against every principle that our founding fathers have ever stood up for. As a matter of fact, I can tell you right now that the efforts and monetary resources that you put into contact tracing will be for naught, because the citizens will stand up and they'll say no. I can already foresee civil disobedience happening to the point where it will actually cost the county more money to put down the civil disobedience than it will to actually contract to trace people. And I'm not talking about violence. I'm talking about citizens actively saying, no, don't talk to me, go away. It's going to be a money pit, and it's going to be pointless to track the citizens. Not only is it against our God-given rights, not rights that are granted to us by our representatives, not privileges granted to us by our government, but rights that are given to us by God. And those rights say that we are to be secure in our own person, our own houses, and our own papers. And the whole concept of contact tracing is anathema from the very core. And that's all I have to say.
Paul Curley.
Yes, my name is Paul Curley. I'm a supervisor in the Harbor Bay Community Development District in Hillsborough County. And since our district does not have a public health department, we're trying to adhere to the policies established by the county and state. If possible, I would very much appreciate someone clarifying whether, assuming we adhere to the published capacity maximums, social distancing, and other guidelines, cleaning guidelines that may be published by CDC and others, are there any orders prohibiting or limiting the following: opening our swimming pool, our pool deck, our clubhouse rooms, playgrounds, tennis courts, and basketball courts for general use, or conducting water aerobics or outdoor aerobics, assuming we direct residents and utilize our limited staff members to monitor adherence to applicable capacity requirements, social distancing, and other guidelines issued by the CDC and Hillsborough and others. If this question cannot be answered in the public meeting, would you mind directing staff to provide me a response via email? Thank you very much.
Thank you. Let's go back and see if Karen Lynch was able to get on. Karen Lynch. Debbie Clark. Okay, that closes the public hearing. Let's move now to emergency management update. Mr. Dudley.
Good afternoon. We continue to support in-home testing and operations at remote collection site Raymond James, Lee Davis, South Shore, and Plant City. Total kits on hand are 5,716. Total tests since beginning of the operation, 11,666. Testing conducted last week, just over 4,000 tests. Homebound testing, 177. Last week, we had 4,392 appointments scheduled. This week, we have just over 3,000 appointments scheduled between the 4 sites. We've had an increase in distribution of glove, masks, face shields, and gowns. We continue to support operations at Donation Management Warehouse located at 250 West Shore Plaza. Days of collection are Tuesday and Thursdays, 9 a.m. to 3 p.m. No significant changes in those numbers at this time. We continue to support quarantine and isolation sites. There's 1 guest in quarantine and 19 guests checked into the isolation site. That concludes my update. Any questions?
I see no questions, Mr. Dudley. Thank you very much. Dr. Holt, public health update. Good afternoon.
Good afternoon, sir. This is Dr. Douglas Holt, Florida Department of Health, Hillsborough County. I will provide 3 updates. The first on our efforts to expand our public health capabilities, specifically on our testing, contact tracing, and long-term care focus for medical surge. Mr. Kevin Wagner will present some of his data information. We're moving towards selecting those that information to share with the EPG on an ongoing basis regarding our monitoring for the potential of a resurgence. And then lastly, I've asked Dr. Patty Emmanuel from USF Pediatrics to provide an update of COVID-19 in children. So as far as the public health capabilities, testing, we have completed 2.21% of our population being tested. We have initiated, along with the private sector plus the state, we've achieved 10% testing of our long-term care facility residents. Draw your attention, we talked a lot about PCR testing that diagnoses active or infected persons. An antibody test would show that someone had been infected at some time. The FDA has just announced that they have okayed the release of what's a new version. It's called an antigen test. I believe that this has a future great potential, and it is an actual big deal addition to our testing. This test detects pieces of the virus, not the genetic material that the PCR does. It detects viral fragments. It's much simpler to obtain. It's a nasal swab instead of the deep probe, making it safer for the healthcare workers and more comfortable for the patient. The early versions that's currently approved, you do need a machine or use an existing machine that can do the similar capabilities, which is primarily restricted to the hospital. You get a result in 15 minutes. These are not here presently, but they will be coming. This is a step towards getting a test that is similar to the rapid flu test that's often done in offices. So it would potentially allow us, once we have the distribution and the manufacturing supply, this test to be available in doctor's offices, CVS, or Walgreens type of clinics. The contact tracing, make a couple of comments. We have added currently 2 Florida Department of Health employed additional staff, and we have 5 more that were veterans from Broward have been reassigned to us. That basically doubles our existing capacity and capability of people that are ready to go. The College of Public Health volunteers, we are training 5 this week, and we expect to ramp that up and put them to work. I would like to note a special thanks to the Tampa Bay Lightning, Jeff Finnick, but particularly Steve Grigg, the Chief Operating Officer. He offered some assistance with some of his staff. At this time, the process of getting them certified and allowed to have access to the sensitive information would take us too long, but I'm hoping that we can work for that in the future. Just to comment on the tools that we have, essentially all contact tracing begins with identifying someone who has been in close proximity such that they might have become infected. It is purely voluntary for the person to engage in this conversation with us. So far, we've had a 90+% acceptance of that with our cases. The whole idea of what we could use from a phone data right now realistically would only be used for the person with their agreement to remind them of maybe where they have been. There may be the capability of notifying others about who they might have been around, but that is not something that we have available to us or that I see us using. These people, we want to identify them, we want to inform them, and we want to instruct them on what they can do. So we must identify, starting with who they are, and then we provide them information on what to do for both themselves and to protect others. Let's start with what they need to do. The first for themselves is that if they are sick or become sick, we will help them and ensure that they are tested as soon as possible. We ask that they undergo self-quarantine. This is a sacrifice. It is not easy for many of the people that we may be encountering. It is much beyond just wearing a mask and social distancing. We ask people to basically don't leave their house or room unless absolutely necessary. That's why we still have our hotel to assist in this. It is basically an honor system. We do check in with them on a regular basis to make sure that they are both feeling well and are complying. The who is a little more complicated. It is essentially a triage. We begin with anyone that is a healthcare worker and particularly a long-term care facility employee. We work closely with the facilities, whether it's a hospital or a long-term care facility, to focus on potential residents and patients that were exposed or co-workers. We engage with the employee on their time that they spend outside of work. Those that would be identified or determined and likely to be a contact would be if you live in the house with someone, essentially they're close to 100% would be identified as a contact. All the rest involve an assessment of 4 factors. How sick was the individual, how close they were to other people, how long they were close to those people, and what setting were they in. If you look at the first part is how sick. And essentially, we know that asymptomatic can spread the infection, but the predominance of those that either have mild but particularly more advanced symptoms. So sneezing and coughing has been estimated to generate 20 million plus viral particles, and they can travel beyond even 6 feet. So if you recall or have been around someone who has been sneezing or coughing, that will identify you as being a contact. Regular breathing, talking, and a little more risky would be being around people that are singing and yelling. It's a variable time. the average that we try to use is if you're just around someone who just through talking or breathing, no symptomatic, it's going to be in the range of 10 to 20 minutes of contact. But as I said, if you've been closer than that in singing, and choir would be an example, that can be modified. We really don't have an idea or criteria for asymptomatics. This is going to be one where we're going to be working as we go. How close? I think everybody understands the 6 feet rule, but it's certainly less than 3 feet is greater than between 3 to 6 or more than 6. Indoors, shared offices versus if you have a large place that is so long as not crowded, there's a distinction. And outdoors is an unusual report of transmission. So the bottom line is what we knew before we implemented mask, social distancing, and others. 90% of the people that we identified and knew where they were infected were in the home, selected workplaces, those that had face-to-face contact. Obviously, I think people have read in the newspapers meat packing because of certain situations there, call centers, and healthcare workers. Social or religious gatherings, especially indoors, have been also associated with outbreaks, weddings, funerals, birthdays, or other type of celebrations. Again, restaurants and bars prior to the new rules were identified. On a personal note, I am comfortable going out to eat, but I use an informed decision. I prefer outdoor seating. I look for those that are less crowded, and I would wear a mask. And I think that's a lot about what I want to say about kind of all of us making informed decisions and situational awareness. Some special settings, public restrooms, I would avoid. My choice. These have both high touch potentials to pick up a virus on your hands, and it's also obviously a closed space with poor ventilation. Shopping or retail is generally a very low risk for the shoppers, but employees do have a greater risk. But employees are screened with temperature and questions. Shoppers hopefully won't go if they're sick, and mask should be prevalent. Outside of the household, face-to-face or sick, mainly it's going to again be those that you have spent prolonged time with, or situations where social distancing were not done. Long-term care facilities, again, the villain here is COVID-19. It's not the people. We are working to assist and help those that are doing their best. The frontline workers, the vast majority, I completely care a lot about their patients. They're doing their best with everything they have to do within the limitations of the facility design with shared rooms. The medical officers, the nursing directors and leadership have never dealt with something like this. This is not like a MRSA. It's not even like influenza. And they are really doing all they can. Mass testing is begun. We have had one facility who took it on their own to do this, and they have found no residents tested positive. We have tested the state tested on 2 by their request. One of them had no residents, no staff, and another did identify 5 residents and 1 staff, but to date we've had no secondary cases in that facility. Working with the hospital leadership, the Florida Department of Health, Hillsborough County Fire Rescue, City of Tampa Fire Rescue are formed part of a task force. We're meeting twice a week. Our second meeting is today. I'm hoping and anticipating want to work to have Thursday to a more detailed presentation about the joint efforts we are doing. With that, I'll turn to Kevin Wagner, Mr. Wagner, to talk about our EPI. This is designed to begin and talk about really what we think would be useful for the EPG as we proceed. We know the trajectory of the cases, looking at a 14-day or 7 days, and looking at separating out the long-term care facilities, because as I said, we are focusing on testing those at a disproportionate number, and it's important that we see what's going on in those settings outside of those facilities, and that's in the general public. To date, our 14-day, most recent 14 days compared to the prior 14 days, we do have a significant increase from 270 to 375. Looking at the last 14 days, at a 7-day, we've had a significant decrease from 238 to 137. That is, again, an aberration that I mentioned last time, because the testing from 7 days ago, as it came back, showed some very positive results from facilities that we worked because we suspected there were more cases than we knew about. The trajectory of the positive percentage, again, 14 and 7 days overall, we are at 5%. I'm intending to work to try to separate out the long-term care facilities, because I believe it will find the general public, or those that are non-long-term care, we will see a much lower percentage. And this is critical as we know what's circulating in the community. Syndromic surveillance, you'll see for the first time our report from the hospitals, and you see a significant decrease in the number of people presenting to the emergency room with COVID-like symptoms. We will continue to follow our deaths reports. We have 38. Our hospitalization, we have 150 currently hospitalized. That is an increase from 133 on Thursday, but again, a large proportion of those were proactively transferred from long-term care. And you can see that because the ICUs have not changed. We now have 32 compared to 28 on Thursday, and our ventilators, 7 on ventilators versus 6. With that, I'd like to turn it over to Kevin, and then after that, I will introduce Dr. Emmanuel. Kevin.
Thank you, Dr. Holt. Chairman, can you see the presentation on the screen, please?
Yes, sir.
Thank you very much. Again, my name is Kevin Wagner, Business Analyst for Healthcare Services Department of Hillsborough County. Following up on Dr. Holt's report, to date, from the inception of the test, there has been over 30,282 tests completed in Hillsborough County, with a negative rate of 95% and a positive rate of just under 5% to date, around 1,432 people. That's the aggregate. Looking at the 7-day split of tests, we were asked to identify the number of negative tests per day that come back as results with regards to the positive. As you can see, the large blue segments are the number of negative tests reported each day from the returning results. On average, it's roughly about 1,950 to 1,000 a day. And then the positive results that we see at the bottom, again, are in the mid-20s on an average, and this is over a 7-day period. Again, looking at the positivity, we are working on an estimation and a process to identify the long-term care facility positive rates versus the general population. This is the initial move towards that. The general population has a positive rate for the week of 5.3 to 5.9 of about 2%. Looking over the same time period, again, an estimate of the 7-day period from 3 facilities that received testing, there was a 94% negative rate and a 6% positive rate of the long-term care facilities, as Dr. Holt aligned, looking for hotspots and areas. But this is the initial estimation of that. The like cases that are presented in the emergency room with COVID illness is presented here from 329 on a weekly standpoint. This is readily available on the FDOH website. We see a downward trend of that from initially 397 back on 329 to 167 on 5/3 as reported by the hospitals. So again, that is trending downward with individuals presenting with COVID-like illness in the emergency room. With regard to the deaths, while this is a lot of information on this slide, to date, when I pulled the report, there were 37 deaths, not 38. It's just a difference of timing. 27 or 10 of them have been under the age of 64, and particularly only 1 under the age of 55. 65 plus account for 73 or 27, or a vast majority of that of the deaths that have occurred as reported by FDOH. So again, a vast majority are 65 and plus and older, over 70%. And again, they are 22 have been female, about 59%, and 15 have been male, almost 41%. Population testing, we present this every presentation. The total test results as the time of pull was 2% of the population has been tested based upon the rural aggregate count of the test of 30,282. So again, 2% of the Hillsborough County population has been tested. Around 98% have not at this time. Future activities following up, we're looking at the trending of positive and negative results by category of the 7 to 14-day time period for the general population and the long-term care facility. And we're working on developing the hospitalizations ICU update that's under development. And I'll stop there.
Commissioner Miller, this is Dr. Holt. I would suggest we open it up for questions for both Kevin and myself before I introduce Dr. Emmanuel.
Okay, Dr. Holt, I don't see any questions at this time, so you can go ahead and introduce Dr. Emmanuel.
Yes, sir. Thank you very much. It's my pleasure to introduce Dr. Patricia Emmanuel. She's the Lewis B. Barnes Endowed Chairman of the Pediatrics at USF, Morsani College of Medicine, and thought it would be useful to talk about COVID-19 in children. Dr. Emmanuel, are you prepared? Are you ready?
Yeah, I'm trying to share my, hi, good afternoon, everyone. I was trying to share my screen. Can you see them? Can you see my slide?
Not yet.
All right, let me try one more time. It's a,
Okay, there we go.
There you go. Great. Okay. So thank you very much for asking me to come today and talk a little bit about COVID in children. It's been an interesting epidemic from the pediatric standpoint. As you know, but you've heard many times, the number of cases of children, both internationally and nationally, are much lower. And this comes from today's DOH dashboard. And you can see the case distribution, which particularly children under the age of 14 is less than a total of 1,000 cases in the state of Florida. The transmission, as we've known, again, is primarily aerosolized and droplet. You know, it is unusual because generally children are the vectors of these types of infections, the respiratory infections, and do shed them readily. The disease has been, the virus has been detected in the stool of infected children. And so there is a potential for fecal oral transmission, but that has not been proven. And it seems as of at this point, most pediatric infections occur through family clusters, although there's really not a lot of data published at this time. There are several reports of suspected vertical transmission. Vertical transmission is from mother to baby. Many cases of no transmission, but there have been several cases where infants were, the virus was detected soon after birth, or the baby had a positive serology after birth. But that is still, again, unclear. And the virus has not been found in amniotic fluid or breast milk, so we are promoting pumping and breastfeeding once mother is no longer actively shedding. Children do appear to get infection at all ages and have similar amounts of virus when they are infected, but it's really not clear what role they have in community transmission. And it's really unclear if there's any super spreaders, as you may have heard about when we talk about some of the adult transmission. It's not clear yet. As we mentioned, disease in children is milder. Only about 6% of children experience severe disease compared to about 26% of adults. Because they're less symptomatic, they're also less likely to be tested. And that's part of the issue of our lack of information. Hospitalization rates around the country, it looks like pediatric patients account for only 1% to 2% overall of all COVID-related hospitalizations in the US. And the mortality is again low. It is unclear. We always worry about our children with special health care needs, our premature infants, our children with severe asthma or on a tracheostomy. But so far, it's really, there have been a few cases related to COVID in leukemic patients with children, but not a lot of data on how, if this is disproportionately impacting children with our special health care needs. And it appears that the group that gets impacted the most are children less than a year of age. There's some interesting ideas of why this is, why kids are not as ill. Part of it is maybe some differences in the receptor that the virus uses, and also related to the way we respond, the host response. So because infants and children have a more immature immune system, that may actually benefit them in this case. I won't go through all the symptoms and cases, but just to let you know that there has been a nice way to kind of look at to categorize the degree of illness in children, and that this has been published, and now we'll be using this moving forward. I make one comment because this families ask a lot about this. There is no approved treatment for children. The infectious disease society guidelines so far recommend no treatment outside of a clinical trial. We are going to be testing the antiviral that was recently FDA approved, and there have been some other trials, including using the convalescent serum. We have to remember that vaccine trials will all be tested in adults first. And one of the other things that we have to be aware of is it's going to be very critical as we move into the fall that children get their flu vaccine, their regular influenza vaccine, because it is going to be be difficult to distinguish these two infections. And the last thing I'll make a comment about right now, very hot in the news for the last several days, is the description of the multi-system inflammatory syndrome. This is different than what we're seeing in adult COVID patients. It has been described in Europe and in the United States. There's about 60 or more cases in New York. These children, again, can be all ages. They present more with shock, fever, rash, abdominal pain, very similar to a disease that we call Kawasaki's, which some of you may have heard of, or a toxic shock-like syndrome. And it may be that this is more of a post-infectious phenomenon. Again, it's rare, but there's a lot in the news right now. So I think that families are asking a lot of questions about this. It appears to be associated with COVID infection in children. So that's all much information to still learn. But that is kind of where we have, and I'm happy to take some questions.
Dr. Emmanuel, thank you very much for your presentation. We truly appreciate it. Commissioner Overman, you recognize for a question.
Thank you. Thank you very much. And thank you, Dr. Emmanuel, for your report. You may be aware that we discussed expanding expanding need for childcare as workers begin to go back to work. We already have restaurant workers, retail workers, and soon a salon and barber workers. So many of these workers are going to need childcare. And previously, our childcare has been for our first responders and our healthcare professionals. So we have childcare centers and summer camps that are trying to figure out how to meet the governor's executive orders that limit, 10 children per room and no cross references. How do you see, given the propensity that children share diseases? I mean, every parent knows that, until the kid is 5 or 7 years old, you're going to get everything under the sun. Have you seen that in this kind of infections, or because the kids have been home so long, do we just not have the data to really determine what the level of spread might be? Thank you.
Thank you so much. I think that's such an important question, and we really do not have the data. We know that overall pediatric visits are down by about 50%. ER visits are down. So children are home and they are not sharing their secretions and spreading. And I think that I've tried before this meeting to find information about the transmission in the daycare or the school setting versus a home setting, and there's still not enough really data to document for us to make a good decision. I think we have to again utilize those what we know, which is as best as we can to limit exposures and to utilize teaching our children. Even at a young age, to decrease, hand washing and decreasing the surfaces. It is going to be a tall order for our daycares. But I can say that the daycares that are currently open for our first responders, they have a limited number of children, but they seem to be doing okay. We have not seen new infections, although the numbers are very small. We haven't seen transmission in daycares yet. I defer to Dr. Holt on some of that.
Okay, thank you. Dr. Emmanuel, I don't see any further questions at this time.
I'm sorry, my hand must not be working. Originally, voice. Now
Go ahead, Commissioner Merman. You recognize. Can you hear me?
Yeah, I can hear you. Can you hear me?
Go ahead. You recognize.
Patty, how are you? I just wanted to ask a quick question. So is anything coming out from USF Pediatrics or the Department of Health on guidelines to the school readiness centers? Because in the next 2 weeks, you're going to see, we have almost 1,100 school readiness centers in Hillsborough County. And though we still have about a third of them still closed, there is a push now to get all of them open. So is there any communication that's going with guidelines to these centers so that some of the things that you said to us are relayed to them going forward?
So I know there's a call this evening with the schools, the FMA and the school superintendents. So we're talking with them. There's a number of pediatricians across the state that are going to be communicating with the superintendents. I'm not sure if that's the same group to try to help lay out some guidance in the different areas. But I'm not sure if that's specific to the school. I don't know what the readiness
Those, that's the Early Learning Coalitions and PCF. They really govern all the child care centers.
Yeah.
So that's the groups that I wondered if information was getting to them to make sure that they know what the guidelines are and things to look for.
No, but we're happy to do that. And I see also Donna is on the phone from the College of Public Health. We would be happy to put some things together for them. I can reach out if you email me, and I'll be happy to reach out and put things together. Especially, I think this most recent data is concerning, and we've gotten a lot of questions about that. So.
I agree. Okay, I will get back to you with the contacts and we can get the information too. Thank you.
Hey, Dr. Emmanuel, thank you very much, ma'am. I see no more questions. We appreciate your participation today, and stay safe. Dr. Holt?
Yes, sir. That concludes our presentation, sir.
Okay, thank you, Dr. Holt. We appreciate it very much. Okay, now we're doing the county attorney's update. Ms. Beck?
Yes, good afternoon, Chairman Miller and EPG board members. Christine Beck, the county attorney. I was asked to give an update on the governor's order that reopened barbershops, salons, and nail salons. In your backup materials, you were provided with a copy of 3 documents. The first is the governor's order number 20-120, which is dated May 9th of 2020, but it became effective today at 12:01 a.m. And the second is FAQs that go along with Order 20-120. And the third document that you were provided with is the Department of Business and Professional Regulation, their regulations related to Order 20-120 is also in your backup. The governor's order issued over the weekend expands upon Order 20-112, which began the reopening of Florida. And it does 2 things. The first is that Palm Beach County is now allowed to move into phase 1 and to begin reopening. And the second is that barbershops and salons and nail salons and others as defined in that order are allowed to, individuals can now attend those businesses or go to those businesses, provided that they adopt appropriate social distancing and precautionary measures as set out by the Department of Business and Professional Regulation. The Department of Business and Professional Regulation has issued the following mandatory restrictions. There are 4 of them. Customers can only be seen by appointment. The appointments there must be 15 minutes between appointments. There can be no group appointments, and masks must be worn. Masks are mandatory by all employees of the salons. The Department of Business and Professional Regulation encourages thorough cleaning and disinfecting of the business location. It encourages considering having the business provide masks to their clients, and it encourages the removal of all unnecessary high-touch items like magazines, menus, etc. And the FAQs that have been provided and are available online simply elaborate in a little more depth on those Department of Business and Professional Regulation matters that further inform the governor's order. I'll be happy to try to address any questions.
Thank you, Ms. Beck. I don't see any questions at this time of you. I think you've gone through thoroughly and explained what the governor's executive order is. So thank you very, very much. I appreciate it. We're now moving to the EPG discussion. Let me start off the discussion today by saying, I try to stay in as much as I can because I'm of that age that I'm 69 years old, and I only have 1 kidney, so I try to have 1 kidney. So I try to do what my doctor tell me to do, and that is stay in unless I have to go to someplace that I desperately need to visit. And the only places I've been is to grocery stores and to the pharmacy. This past Friday, I did go to 2 grocery stores because I wanted to do something for my wife and have her stay home. I went to 2 grocery stores, and I know that we have not mandated the wearing of facial masks in Hillsborough County. We have only highly encouraged people to wear masks in Hillsborough County, not only for their own protection, but for the protection of those that are around them in case they may have the symptoms or may have the symptoms and don't know they have the symptoms, or embedded in them, or someone else may have those symptoms. That we have highly encouraged throughout Hillsborough County, the 3 municipalities, to wear masks. I was utterly shocked that when I went in one grocery store, I was probably among the 10% that was wearing masks. The other 90% was not. The one grocery store had outlined the aisles you can walk down one way and aisles you walk down another way, and had identified the 6 feet apart. Ladies and gentlemen, they weren't paying any attention to that. And I stood there on one and basically watched people look at it and say, "How the heck with it," and keep on down the aisles. They were not paying attention to it at all, and not one bit. I went to the next grocery store and was basically the same thing, that probably 90% of those people that were in the store was not wearing masks. And I think this has come to the point that the opening of the state has given people the opinion that now I can do whatever I need to do. I don't have to wear the mask. I don't have to follow the guidelines, whatever the case may be. I know we're not going to mandate wearing masks, but I hope that some way, somehow, again, that we can strongly encourage the people of Hillsborough County that if you're going out and you have a mask, please wear it. Please adhere to social distancing. Please adhere to the gathering of groups. If you go in these stores, the stores have outlined directions that they want you to follow. Please follow them. It's not trying to take away your constitutional rights to tell you what to do in the store. It's trying to protect yourself, protect you, and protect others in the stores or the situations that you're in. It's nothing to take away your constitutional rights. So just to abide by them and please adhere to them, because we're trying to protect folks. So if you have masks and you're going out, please wear it. Please wear it. We're not going to mandate it, but please, we beg of you to wear the mask to protect yourself from others, protect others possibly from you. I just had to say that. Is there any other discussion today? Any other discussion today? I don't see any hands. Mr. Merrill, is there anything else?
No, nothing from our end.
Okay, ladies and gentlemen, seeing no hands and no further discussion, we're done until this coming Thursday at 1:30. Stay safe, and we'll talk to each other at that point. Have a great day.
You too.